Now, in Europe, Denmark, Norway and Iceland have temporarily suspended the use of AstraZeneca's COVID vaccine over concerns about patients developing post-jab blood clots. Denmark was the first to announce its suspension of all its AstraZeneca supply, followed by Iceland, Norway. EU medicines regulator, however, has said that AstraZeneca COVID vaccine use can continue pending the blood clot probe. Even the suspension, it's been said, is brief. Now, we spoke to Dr. Guleria about these concerns being raised by European countries about the AstraZeneca vaccine, which is one of India's main vaccines, called Covishield here.
AstraZeneca vaccine, which is the same as our Covishield, there is a concern in countries like Iceland, Denmark and Norway that it could possibly be causing blood clots, right? And they have suspended this particular vaccine. What's your reaction to this, and should this be a cause of worry here in India?
So this has been done basically in the three countries that you mentioned, and also has been suspended in Austria, based on the fact that there have been two patients reported there who had clotting, and one death in Denmark and one in Austria of an individual who a few days after vaccination developed clotting and a pulmonary embolism. One patient is also in the hospital but recovering. The issue is there a cause and effect relationship? Is it a coincidental effect? Now, if you look at the number of people vaccinated in other countries, UK has had a huge number of people who have received AstraZeneca. There has been no red flags as far as clotting is concerned. But there is a concern which the European Medical Agency has raised because of the fact that a few days after vaccination, these, I think the number is around 22 individuals had some clotting, and they want to look at it in terms of whether it's a coincidence or there is a cause and effect. And therefore, for 2 weeks, the vaccination process has been suspended in these countries to really get more data. I think the signal, we need to investigate it, but I don't think it's a cause of concern right now, because there's been a huge number of people who've been vaccinated in millions across the world using, and AstraZeneca has been used extensively. We haven't seen any such signals anywhere else. So it could be more of a coincidence rather than actually a cause and effect.